This is a gentleman who came in a week ago with complaints of pain and discomfort on the back of his head. He had a cyst there about the size of a golf ball, and it got inflamed and infected. So this is an issue with cysts. These are called epidermoid cysts. A lot of people also call them sebaceous cysts. So he came in to see me because he was planning on having the area excised. Well, when I looked at it, I realized that it was still inflamed. So it was kind of boggy to touch, meaning when you push on it, it's mushy, or it fluctuates. So you don't want to do an excision on an inflamed or infected cyst. This is when you could potentially increase the risk of bacterial infection spreading somewhere. I did use iodoform gauze to pack the wound so that it would potentially help it to heal faster and decrease the risk of further abscess formation. So I wanted to introduce this guy who has this abscess on his neck, but I wanted to tell you a little bit about him because he's very interesting. During his visit with me, he showed me all these kind of scars he had on his forehead. They're all vertically oriented. You can see it in this picture that I'm showing you. And he told me that he was a WWE fighter, like along the times of, during the times of Hulk Hogan and that sort of thing. So it's really interesting that he told me this is what they used to do in the past. They used to hide razor blades in their clothes, and when they went down, they would use the razor blade and cut their face so that they would get blood. And, that was part of the show of these fights. So he has all these vertical scars across his forehead. Very interesting. That's what they did back then, and so this is the kind of thing that I get with my patients, which is what makes my job so much fun and so enjoyable. So it's just part of what I do, and I wanted to let you know. I just wanted to give you that information. It's kind of interesting for you, so I hope you enjoy. We'll see if there's anything still in here. Okay, in your little abscess here. Not hurting, right?
No, but last week, Doc, a lot of stuff came out. I mean,
yeah,
a lot of stuff. Then when I took a shower the day before I came, it started leaking again.
Yeah, usually warm showers will do that to you. I think you might have gotten most of it out. Yeah, it does look like it. I'm gonna push against you.
Go ahead. It's fine.
There's still something there.
Wait, Doc, what is it? Why does it keep coming back? I mean, what is this?
There's a cyst under there, and there's a sac. The cyst is encased in a sac. So if you have the sac contents are still there, it will reform. It can reform. So that's why you have to take the whole sac contents out. But it's hard to do that when it gets infected, because then it's all mush.
Yeah,
like you can't tell what sac and what But when it's nice and clean, like we actually right before you, we just did a clean cyst extraction on the neck. And if I showed you a video of it, you'd see about it. Kind of comes out in one piece. I saw pieces just now when I squeezed you. Parts of this came out, but I think that's why. I mean, there's still parts of it that were in there.
Yeah.
And
I'm just sick of it. I'm tired of it.
I know. Thank goodness you don't get like that with your wife.
No. That's a life sentence.
Let's see. But yeah, I think that you definitely had an infection there, and we're gonna let this heal kind of open, you know what I mean? Yeah. I mean, just a little open. It's nothing crazy. But we're going to let it heal open, and then we won't have to pack it because it's not very deep, but we'll let it kind of heal open. You know what? I think I'm going to pick up. We'll wait for it to get nice and calm, and then we'll cut it out, okay? Let's make sure that none of this is too much of the sac contents. That's good here. Oh, here's some of the sac wall. Not hurting, right?
I don't know.
What, you said that not a little bit hurting?
A little bit.
Sorry. Oh, at least you can giggle. I'm going to push it. Let me put one right under there. So I'm going to kind of put this absorbent kind of pad here and kind of fold it. Okay. And twist it under there. So as you remember last time when you had a really big one, what you want to do is try to just gingerly push out some of it and then snip it. I think once a day. You can kind of give it like, you know, whatever you can kind of pull out. I don't think it's going to be very big. This is not a really big area here. It was pretty much, you had a cyst here that was infected, but it's pretty much healed. It's just that there's an empty space here, so I just want to get it so that, you know, you can, it will heal in and not be like a little empty, because if you have big empty space there, it will promote happening again, like a big space there, or maybe a little infection there kind of thing. But it's pretty dry. That's also good.
I'm just sick of it. I'm just tired of it.
Yeah, I folded it like a ribbon. You'd like let it, I don't know, like a folding it back and forth like loops, you know, okay? I know you're sick of it.
So just like a 1/4 inch or a day or less or more?
Yeah, let me actually look and I'll see. Yeah, I would say like a 1/4 inch or so.
Okay.
There you go. Snip that line. We'll leave that right there for now. And then we'll kind of cover you up here, okay?
Okay.
We'll check on you again too. You don't live too far. Oh, you do? Yeah. Well, you know what? We'll give you our cell phone that you can even text us pictures.
Okay.
If you're like, you know, is this right or whatnot? You know what I mean? Okay.